section through the neck at the level of 6th cervical vertebra to show the disposition of different layers of deep cervical fascia. Initially, we need to draw a circle. Then you need to write the cervical vertebra, the body of cervical vertebra, just behind that. So next we are writing the parts of 6th cervical vertebra. So these are foramen, transverse area, body, vertebral column, foramen and the spine. So these are different parts of 6th cervical vertebra, that is C6. So main thing how you differentiate is by the presence of foramen transversarium. Next we are writing in the center the esophagus, which is compressed antero-posteriorly. Compressed antero-posteriorly. We label it as esophagus. Anterior to esophagus we are writing trachea. Posteriorly the trachea is flat due to presence of trachealis muscle. Anteriorly it has got C-shaped tracheal rings made up of hyaline cartilage. So these are the three things from antero-posteriorly we need to write initially. Then we'll mark two lines like this. Next we are writing the thyroid gland. What gland? Thyroid gland. This is a transverse section, so it should be present in this. So it has got right, left lobe and in between the isthmus. Thyroid gland appears in cut section as shown in the diagram. As this, after this we are writing two large muscles that is present on the posterior aspect and also on the anterior aspect of the neck. We'll mark different points. So that is the sternocleidomastoid. We are writing sternocleidomastoid. Posteriorly the two muscles are trapezius. We label it sternocleidomastoid. Posteriorly it is trapezius. After this we are writing smaller muscles and we'll label them as omohyoid muscle, omohyoid superior belly. Sternohyoid, we are labeling sternohyoid. This muscle is sternothyroid muscle, sternothyroid muscle. So these are muscles that are present deep to sternocleidomastoid. Similarly on that side, on the right side also we are writing. Next, trapezius we label the trapezius. Then we'll later take green color sketch pen to draw the investing layer of deep cervical fascia. It is one of the part of deep cervical fascia, that is investing layer. It encloses two important muscles. We label it investing layer of deep cervical fascia. Investing layer of deep cervical fascia. It encloses sternocleidomastoid and also it encloses trapezius. Two muscles it encloses, sternocleidomastoid and trapezius. So this is all about investing a layer. Next we'll go to one more layer or one more part of cervical fascia, that is carotid sheath. Carotid sheath. carotid sheath. The carotid sheath, it encloses or it is present around common carotid and internal carotid arteries, internal jugular vein and vagus nerve. A carotid sheath is related to ansa cervicalis anteriorly. So three structures are there, we will label it. Anterior to carotid sheath, you got ansa cervicalis. Posterior to that, we got sympathetic trunk, is labeled as ansa cervicalis. Posteriorly, we got sympathetic trunk. Sympathetic trunk. The carotid sheath is wedged between three layers of deep cervical fascia. Later we'll label thyroid gland. Thyroid gland is enclosed within the pretracheal fascia. It is enclosed within pretracheal fascia. The pretracheal fascia. We label it as pretracheal fascia. That is the trachea. Next, the last layer, that is the prevertebral layer. Pre means in front of the vertebra. That is prevertebral layer of deep cervical fascia. The prevertebral fascia. It is extremely strong and lies in front of prevertebral muscles. This carotid sheath is wedged between three layers of deep cervical fascia, which can be shown as above. So finally, we got pretracheal layer, the carotid sheath, prevertebral layer and the investing layer. So this is present at the level of C6 vertebra, deep fascia of neck subdivisions. Smaller muscles we can write, that is the scalenus anterior, this is splenius capitis, scalenus anterior, scalenus medius and scalenus posterior. All these are the prevertebral muscles. So this finishes the diagrammatic transverse section of the neck at the level of C6 vertebra to show horizontal disposition of three layers of deep fascia of neck.